Fetal movements are weak. The fetus does not move enough in the mother's womb. Hi. The phenomenon of fetal movements not only helps the mother feel the life growing in her body, but monitoring fetal movements is also an effective method to check fetal health. Fetal movements are a sign of the health status of the fetus. When the number of fetal movements decreases, it is an alarming sign of poor health of the fetus. When the fetus does not move or moves weakly, the fetus may be weak or stillborn. Normally, pregnant women will begin to feel fetal movements in the 20th week of pregnancy. Usually in the second trimester, the fetus's movements are often irregular, but later on, they become more regular. The most active time is from the end of the 25th to 32nd week. Insufficient fetal movement in the womb, also known as reduced fetal movement, is a phenomenon in which the baby developing inside the mother's uterus exhibits reduced movement compared to normal indicators. Fetal movement is considered an important indicator of the baby's health and especially the neurological development. Although occasional changes in fetal movement are normal, persistent decreased fetal movement can be worrying and may be related to many different factors. First of all, let's talk about possible causes of insufficient fetal movement. There are many causes that can reduce fetal movement. The following are some very notable causes recorded. 1. Mother's health, maternal factors. Maternal health problems such as obesity, diabetes, or hypertension can affect fetal movements. Drug use, including smoking or certain medications, can affect fetal movement. 2. Placenta insufficiency. Problems with the placenta, such as reduced blood flow, can affect the transport of nutrients and oxygen to the baby, potentially affecting fetal movements. 3. Umbilical cord issues. Abnormalities in the umbilical cord, such as knots or tight wrapping, can limit the baby's movements. 4. Fetal factors. Developmental abnormalities, neuromuscular disorders, or genetic factors may contribute to reduced fetal movement. And 5. Insufficient amniotic fluid levels. Low levels of amniotic fluid can limit the baby's movements, as amniotic fluid functions to provide cushioning and space for fetal activities. So, how can fetal movement status be monitored and evaluated? There are two simple ways to monitor and assess the health of the fetus that pregnant women are often advised to do. 1. Kick counts. Pregnant women are often advised to monitor fetal movements by counting the number of kicks or movements within a specific period of time. If you see a noticeable decrease, you should contact your doctor soon. And 2. Ultrasound. This is also a very normal thing for pregnant women today. An ultrasound examination can assess the health of the fetus, including movement, position, and overall development. So, what is the clinical significance of decreased fetal movement? 1. Early warning sign. Reduced fetal movement can be an early warning sign of potential problems with the baby's health, requiring timely intervention. And 2. Signs of fetal distress. A persistent decrease in fetal movement may be a sign of fetal distress, requiring quick and timely medical examination and intervention. To avoid reduced fetal movement, which means to ensure normal fetal development, pregnant women as well as professionals must do the following minimum things well. 1. Medical evaluation. Pregnant women experiencing decreased fetal movements are encouraged to seek prompt medical attention. Healthcare providers will conduct an assessment to determine the cause and devise an appropriate plan. 2. Non-stress test, NST. NST is a common diagnostic tool that monitors the baby's heart rate in response to its movements. This test helps evaluate the health of the fetus. And 3. Amniotic fluid assessment. Monitoring amniotic fluid levels through ultrasound can provide insight into the baby's environment and potential limitations in movement. So, insufficient fetal movement is a significant concern during pregnancy, and addressing it requires collaboration between pregnant women and their healthcare providers and medical professionals. If you are pregnant, regularly monitor your baby's movements, seek prompt medical attention, and conduct diagnostic tests if necessary. Those actions are especially important steps to ensure the health of both mother and child. Furthermore, early identification of problems associated with reduced fetal movement allows for timely intervention, potentially minimizing risks and ensuring normal, healthy fetal development outcomes. Wish you health. Thank you. Goodbye and see you again.